This is Physician Spotlight, where we highlight top physician specialists in the mid-Michigan area. And today I have with me Dr. Fellenbaum. Welcome.
Thank you.
I know some of you may have some sensitive issues that you're wondering about and you want to talk to your gynecologist about. And today we have Dr. Fellenbaum to kind of talk through some of those issues with us. Tell us about some of the things that you do in your practice.
Okay. I've been interested in issues that affect the problems that occur during intercourse.
Okay.
And also the problems that occur on the female vulva. And essentially have opened a practice that has been now in this Flint area for about 20 years. Most of the time, the discussion of pain during intercourse is restricted.
Right.
Obviously, intercourse is supposed to be pleasurable. If it's painful, then the patient may think that maybe I'm the odd man out and I'll just not mention anything.
Right.
But there are entities that we know exist. We are learning more and more about these entities, and we have specialized in their treatment.
What kind of symptoms would they be? You'll have to kind of...
The basic symptom is either itching,
okay,
burning, pain during intercourse, and aside from the dermatoses, the pain during intercourse can fall into the category of either vulvodynia or vestibulodynia, which is becoming a large area of interest throughout the United States.
Okay.
I belong to a number of societies and am a national counselor for the North American Society for the Study of Vulvovaginal Disease, as well as a member of the National Vulvodynia Association, which keeps in very close contact with these ladies who are experiencing pain.
What would that pain be caused from? So just, I mean...
Well, what we know, and what's very interesting about this, is that it can be caused from birth control pills.
Okay.
There are a subset of young ladies who will have downgrading of estrogen and testosterone receptors.
Okay.
We also know that there are a subset of women whose neurologic hookups are much more amplified than others. So they're
more sensitive.
They're more sensitive, and they're not only more sensitive in the vestibular or vulva area or the outside of the vagina,
okay,
but they're more sensitive on their arms, around their belly button. Various places like this show us that this person may be in that particular subset of women who have increased pain because of that particular sort of the variation in nature.
So someone that's obviously a sensitive issue, and they say, I want to come and speak to you, Dr. Fellenbaum. So they're going to come to your office.
We see a lot of younger patients who have all sorts of difficulties during and after intercourse, and so we need to evaluate these girls and make them understand that this is really you're not in a situation where you're a freak of nature. You're a variation, and we know how to treat that variation.
Right. For more information on Dr. Fellenbaum and the Mid-Michigan Vulvar Care Center, visit physicianspotlight.com.